if you have a client, a participant who or yourself want to participate in vigorous intensity exercise, so you want to get your heart rate up to that 90% of maximum heart rate during pregnancy, it should be safe to do that up until near the end of the third trimester.
Hi, Kassia. It's my pleasure to have you on Evidence Strong Show. If you could briefly introduce yourself, that would be great.
Hi, Alex. Thank you so much for inviting me on. My name is Kassia, and I do pregnancy and postpartum research at the Australian Catholic University up in Brisbane. It's been my passion to explore all things pregnancy, and how the body changes and how we can influence that with exercise as well. Ever since was pregnant with my first child in 2016, I realized that the evidence was really lacking, and I was doing kidney disease research at the time, and this was an area that I was reading about all the time anyway in my free time, and decided that's where I wanted to target my research. So I was pregnant with my first baby in 2016, decided to research pregnancy and postpartum and how we can change that and influence the outcomes with exercise, and how we can do so safely.
That's amazing. We definitely need research in this area. We said it on this podcast with multiple guests already. So, very needed research. So, I'm excited. And I think we should start with introducing the study. So, I invited you from the study called The Effects of Vigorous Intensity Exercise in the Third Trimester of Pregnancy, a systematic review and meta analysis. So, you have done a great job of summarizing the literature and measuring kind of what do we actually know and how much we know about pregnancy and vigorous exercise. So let's start with the definition. What is vigorous exercise?
So the definitions we used for this study are from the ESSA position statement, and there's a few different ways that intensity is measured. So it can be considered a MET, so a metabolic equivalent task of 6 to 9 METs, between 70 and 90% of maximum heart rate or predicted maximum heart rate, 60 to 85% of heart rate reserve, or between 60 and 85% of VO2 max. So often the intensities are estimated because we don't have true max values for most people, particularly pregnant women, when we see them in our studies. So these percentages are an estimate of what their predicted maximum is, but generally that gives us a fairly good idea of the intensity range if someone was to work in the vigorous threshold. And anything above those intensities is considered high intensity exercise.
Would you have like a working definition? So if someone is exercising, how can we tell whether it is medium effort or vigorous intensity exercise?
So the most accurate way to do it would be through measuring heart rate, and the devices are a lot more readily available these days. If you have a smartwatch, that can be a great way to see how hard you're working. So if you were looking to exercise in the moderate intensity range, you'd be looking at keeping your heart rate between 55 to about 70% of your heart rate maximum. And currently the guidelines for pregnancy are very heavily based on those moderate intensity range and keeping the workout within that space, because that's where the most of the evidence is. And that's largely due to restrictions around ethics and safety, particularly in pregnancy. We have to take a very soft, slow approach to working out what's safe. But there's evidence starting to emerge that vigorous exercise is okay in pregnancy, and that's what led me to do this study. I wanted to pull together all the evidence so we can have a bit more of an idea of exactly what the outcomes are if women do want to do more of that vigorous intensity exercise rather than the moderate, which is what they've been likely told to do by all their healthcare providers, professionals, friends, social media. It's all based around that moderate intensity exercise, which obviously is not always appropriate for such a generalized recommendation. If you have women or who are highly active athletes, they're not going to be suddenly, dropping their exercise back, or they're not likely to. What's likely happening is they're continuing these higher levels of exercise that they're used to, but probably doing so with a lot of fear, with all the misinformation that they've been given. So that's where I wanted to pull together the evidence and see what the outcomes were from that.
How did you go about preparing the study?
So what I specifically wanted to look at was the studies so randomized controlled trials, all cohort studies, so retrospective or prospective, so just looking at what people did, particularly in vigorous exercise and see what the outcomes were from that, because there has been so much research in the moderate. I just wanted to break down to the vigorous. Ideally, I wanted to break it down into the trimesters because there is such huge physiological changes that occur throughout pregnancy. Unfortunately, there wasn't enough research for that. There wasn't the vigorous intensity data studied in the first and the second trimesters. It was all in the third trimester. So I pulled together all of the studies that reported vigorous intensity exercise. And an important thing to note here is that the way people report exercise intensity is not consistent, which makes it difficult when you're trying to look through the research. So using those definitions I explained before, I had to read through all of the studies, and regardless of what the articles titled their intensity, had to look more objectively at what they actually did and use those studies and compared it to the control group that they used in those studies, whether that was moderate intensity exercise or low intensity or sedentary behavior, and just seeing what the outcomes were just from looking at the vigorous intensity group. And what we found is that the birth weights, which was the primary outcome of the meta-analysis, because we know birth weight is really strongly linked to fetal health or infant health in the future. And there had been some mixed studies in the past about vigorous intensity exercise and how that could affect and that could have an influence on the baby's birth weight. So what we found is that the birth weights of the mums who did vigorous intensity exercise was not significantly different to the mums who did moderate intensity or sedentary behavior. So it seemed that with these mixed studies that we found in the past, when we pulled it all together and provided like a weight to the evidence, there wasn't a significant impact, which was really important news for people who were doing this exercise already, to give them that reassurance that, what they were doing is safe for their baby. We looked at a few other measures as well. We looked at small for gestational age and maternal weight gain as well. And again, found no difference between the vigorous, the moderate, and the sedentary groups. We did find that it was actually reduced maternal weight gain in women who were already overweight or obese, but not in the normal weight women. So in women who are overweight or obese, they may actually benefit from doing vigorous intensity exercise. And we also found that the vigorous intensity exercise participants had a longer gestation and a reduced risk of prematurity. So they were actually able to keep the babies in a little bit longer. And that just may be reflective of the fact that they were generally healthier pregnancies. But from the conclusion, in summary, the vigorous intensity wasn't harmful to the baby in this healthy population of pregnant women. So obviously this might not apply to every person. This is very generalized information. If there's any sort of clinical condition, then it would be something you'd need to speak to with your healthcare professional. The birth weight of the vigorous intensity exercising mums was slightly lower, but it wasn't significantly lower. So they were still in a normal clinical healthy range. And what it seems from past research and mechanisms is that it's the fat deposition of the infants that are slightly lower in the mums who are exercising more, rather than a loss in lean mass. So not actually a negative impact for the babies, and it didn't result in a clinically diagnosed small for gestational age baby. But potentially if you have a baby who's measuring on the smaller side, you might want to consider cutting back some of that more vigorous exercise and keeping it at the moderate intensity.
Excellent. Do you remember how many studies you had in the meta-analysis?
So we ended up including 15 studies in the meta-analysis. So they're the studies that met all of the criteria for having one group in their study that met vigorous intensity definitions and also had a comparator group as well. So 15 studies in total, which you pull together all of the participants within those 15 studies, that was over 32,000 women. So, which is why meta-analyses are the strongest level of evidence, is we can get those bigger sample sizes so we can be more confident in the outcomes that we're reporting.
Let's try to sum it up. So, if you would have to give 3 points from the study for athletes and the coaches about vigorous intensity exercise during pregnancy, what would these be?
So the majority of these studies were aerobic exercise. So we weren't able to break it down to mode to see if there was differences with strength training. And that's important work for the future. But for this analysis, we're looking purely at heart rate. And so the take home message is that if you have a client, a participant who or yourself want to participate in vigorous intensity exercise, so you want to get your heart rate up to that 90% of maximum heart rate during pregnancy, it should be safe to do that up until near the end of the third trimester. Unless you have complications or any risk factors or you're unsure, you feel uncomfortable, definitely you need to talk through that with your healthcare professional. But it does appear to be safe for your baby to participate in those higher levels of intensity of exercise. So you should be able to do that and enjoy all the other benefits that come from maintaining an active pregnancy.
Awesome. Did we cover everything you wanted to say about the paper?
I do want to say so the reason that we looked at vigorous intensity exercise and not the high intensity, which is the next step above, is because the guidelines recommend us only going to 90%. There's very few studies that have pushed women higher than this. And there has actually been a couple of studies since my meta-analysis was published looking at higher intensity interval training. And it seemed to be okay. But there is still a lot more research needed in those levels that are above 90% maximum heart rate. And that's based off one very small study many, many years ago where there were a couple of athletes who did maximal exercise tests. And when their heart rates went above 90% max heart rate, the baby's heart rate did drop and it was considered fetal bradycardia, so indicating some level of fetal distress, which was only transient. It did go back to normal. So we don't know what the long-term implications are of that. But from that study is where we've reached the limit of 90% until we can very gently sort of push that and see what is happening if you do go above that 90% maximum heart rate and, what's happening physiologically to the baby and to the mum. So that's why we recommend keeping it below 90% max heart rate at this stage and just stay tuned for future research in the area.
I think previous generation was advised to not carry more than 2 kilos and almost lie on the couch during pregnancy. So, we went from unrealistic to okay, this is what we know, this is where we at. We running the studies, we're trying to get more evidence, but it will take time. So I think the progress is huge. We have to acknowledge that, but there's still some work to be done. So that's good. That's where we at. So very grateful for you coming in and speaking on it.
Thank you for inviting me. I love sharing all things pregnancy and the latest research. And I know it is hard to stay on top of all the research that comes out, which is why I've created an Instagram called The Pregnancy Movement, where I break down the latest research that comes out in the pregnancy and postpartum space related to exercise and really all things health. So we can share some of this great research that is coming out and make sure it's getting in people's hands so it can be used out in the field.
Awesome. Thank you, Kassia, for today. Great pleasure.
Thank you so much for having me.